to introduce Dr. Clifford McDonald from the CDC, who will speak with us this morning. Dr. McDonald graduated from Northwestern University Medical School. He completed an infectious disease fellowship at the University of South Alabama and a medical microbiology fellowship at Duke University, and is a former member of CDC's Epidemic Intelligence Service. Dr. McDonald is currently the Associate Director for Science in the Division of Healthcare Quality Promotion at the CDC. He has published extensively in healthcare-associated infections, especially Clostridioides difficile infection and antibiotic resistance, and has led efforts of his division to explore the application of microbiome science to public health. Since March 2020, he has served in various roles in CDC's response to COVID-19, including most recently as the Chief Medical Officer of the response. Welcome, Dr. McDonald. We're happy you're here with us.
Thank you, Dr. Rona. Can everyone hear me okay? Everyone hear me? Good, thank you, thank you. Well, I appreciate being invited here today because I live here in Gwinnett, I live in Lilburn. I love living here. I've been here since 2003. My kids attend Gwinnett Public Schools, and we really enjoy living here. It's a great place to be. I think we all have a lot to be thankful for living here in Gwinnett. So, of course, it's a very difficult time in our country, and these numbers here show this. With a steep incline in the daily number of cases, shown here on the left of this slide. Nationally, this is as of yesterday, over nearly 11 million cases, 138,000 cases new yesterday, or actually the 15th, that was the 15th. And the daily average in cases in the past 7 days has been 47% higher than the previous 7 days. So we're definitely going in the wrong direction as a nation with a steep incline. These are just the daily additional cases. This is not cumulative cases. And on the right is the deaths. And actually there's a lot of good news in this death curve. Despite the rapid increase in cases, still a relatively mild increase in deaths. And you've seen that on the news that overall, the case fatality rate does seem much lower now as we're into this further. And we don't know exactly why, but probably it has a lot to do with the way we're managing them in healthcare. It's not clear whether hospitalizations are really decreased proportionally to the death rate, but once people get into the hospital, we have better ways of managing them. So let me see if I can advance the slides here. Okay, there. So when we look at Georgia it's shown here in a dark color. I'm sorry, I just had to take screenshots. These are from CDC COVID tracker, and so there's national data there available. Georgia looks worse than it really is, just because Georgia had a recent bolus of I think what were previously probable cases, maybe from the antigen testing, they're starting to be used, these rapid point of care antigen tests. And I think they just uploaded some of those. And so some of that is an artifact. Actually, if it wasn't for that just occurring the last few days, Georgia actually looks very, very good on this map. And even with that bolus of reports just recently, they're still looking fairly good. But if it wasn't for that bolus of recent probable cases being uploaded, it would be a light green state here with one of the lower rates. And we've not seen up to that reporting artifact, I'll call it, that bolus of probable cases, Georgia has been really holding quite steady. So we'll have to see after that reporting artifact what happens if we stay level, but we've been pretty level up till that point. And another good indicator of where we're going is the percent positivity. So this is, you know, of at least the PCR tests. And some of this could be kind of confused now with, you know, we're challenged with where we have the advantage of having more tests and different types of tests and these point of care tests that can be used close to the patient. They have their own challenges and limitations, but one of the limitations and challenges is getting their results reported. But if we just look at the PCR test, our percent positivity is actually 6 to 10%, which we'd like to have it under 5%. This is, remember, of the tests that are being done, what are the percent that are positive? And this we find is one of the really good indicators of where you're headed as a locality. The goal is to keep that percentage under 5%, but 6 to 10% right now is not that bad. I mean, there's a lot of states here shown in dark blue that are 10 to 20% right now, and some 15 to 20%. And that's too high. It says that their disease is getting out ahead of their testing. In other words, the infections are getting out ahead of their testing. And they're going to see their infection numbers increase in time. So right now, we're a little bit confused by the recent report of probable cases, the bolus of reports, but overall, I think that we're going to see things hold steady for a while. Now, we may go up very rapidly after that. And I think, Dr. Arona, you'll be going into greater detail into this type of data, so I won't say too much, but I think Gwinnett is in a good place in the state too, overall. And then the other thing is just, you know, the hospitalizations, and you'll talk more about that. And this is total hospital beds and usage and utilization. But when we look at the hospital beds that are being used for COVID patients, it's around 11%. So you'll say more about that. Anyway, so what do we have to look forward to? Actually, I think the second thing in the agenda is what have we learned? Well, we've learned a lot, and maybe we can do some Q&A. I don't know if that's possible, but you know, we've learned a lot. We've learned how this thing is transmitted. It's through close contact. It's mostly through it's almost virtually all through the respiratory route. We know now, of course, that a lot of transmission can be coming from asymptomatic persons or pre-symptomatic persons, and probably 45% or as many as 45% of cases are being transmitted that way, or 45% of cases symptomatic. So a significant proportion, I think we can say. And so that's some of the stuff we've learned. We've learned that most people make antibodies. It really does look like people are probably immune at least for 3 months. In fact, if you get COVID, CDC guidance now says that you would not have to re-quarantine if you're exposed again for up to 3 months or 90 days. And it's probably that you have some level of protection after that as well. But we're not telling anyone to stop the precautions because we don't know when that protection stops. That's the problem. And so, and we don't know how protected you are. Some people may be more protected than other people after an infection. Anyway, so I can say more about what we've learned. I just want to focus on what's coming up. Of course, we got big celebrations coming up. I was telling Dr. Rona that I have several college students coming home. We'll be picking one up this Friday. We're trying to sort it out as a family, a large family, how we're going to deal with all this. A lot of you are too. CDC has said, you know, we have to adjust. We have to flex to how we celebrate Thanksgiving. You know, we live in a great place because sometimes the weather is very cooperative and we can move stuff outdoors even at this time of year, but sometimes we can't. You know, if you go to the CDC website, look at this, it'll talk about, you know, your family unit, who have you been living with most of the time. Other people that come into that family unit pose a risk because they can bring it in asymptomatically. So, so you have to adjust to that. Keep gatherings small, keep them outside if possible. If they're inside, be masked most of the time if you have people from outside your family unit. Now, if you're all family unit, then you can go right ahead. So we're trying to figure it out as these college kids come back. When are we going to have them mask? Most of the time when they're around us, same airspace, same room, that type of thing, at least for 10 days or so. 14 days, is the incubation period, but the median incubation period, the 50%, where 50% declare, is at 5 days. So it's clustered more in those first few days, right? But a lot of those people could even be asymptomatic too, especially college kids. So, especially the first 7 to 10 days, trying to sort of have them self-quarantine from us is what we're going to be trying to do. But we know when we eat, we have to take the masks off, right? And that would be great if we could be outside, or we could have different people eat at different times in small groups who have similar exposures. So these are these things that we're all trying to deal with, and we're trying to offer and do things that are doable, right? Smaller gatherings with people you've mostly been living with, moving outdoors whenever possible, and using masks whenever possible with anyone else. And speaking of masks, what have we learned? We've learned that masks work, and I really want to emphasize this. I know there's a lot of debate about this, a lot of different opinions, but we've known for a long time with diseases like tuberculosis, clearly an airborne disease, that if you put a mask on the patient, it's very important to do that. When you bring them into the hospital, say they have tuberculosis diagnosed, put a mask on the patient, you've decreased the risk a lot there, but we still then use other airborne precautions in those cases in the hospital. But this scientific brief, I encourage you to check out. The link is on the bottom, and Dr. Rona, I'll send you these slides if they're of any benefit to anyone at all. But you can go to this link. This is a document that reviews all the evidence. And what we've said, and this just came up last week, what we said is that there's protection both for the wearer as well as for everyone. So the biggest protection is if the person who has the disease is wearing a mask, okay? It's what we call source control. And that's why it's so important. If everyone would wear masks, we'll be maximally protected. But even if you're just wearing a mask, you're getting some protection from that from everyone else. When both people are wearing masks, it's even better. So let me just show you some data that kind of impresses that. And this was just published in a journal, not a very prominent journal. You probably didn't hear a lot about this in the news, but just a mannequin setting like this, and you can see where they have one in this chamber. They have one mannequin that's has a nebulized solution of SARS-CoV-2 virus. They actually use the virus in this chamber, and it's breathing out the virus in small particles on the size range shown here of 5 microns. And these are very hard to usually guard against, so to speak. They're the smaller particles. Masks work even better with the larger particles. But these small particles, this study really showed that masks work. And they showed by putting a mask just on the receiver, that's just if you're wearing a mask and the person who's contagious is not wearing a mask, even that has some benefit, but even better when you have it on both. And I don't know, I don't want to show a lot of numbers and confuse people, but this slide really shows that the spreader is the person who's the spreader, and then the receiver, and the different type of masks here. And this is the percent reduction in how much the receiver is collecting of the virus. And you can see it's pretty remarkable when both the combined on the left side of the slide, when both people are using the mask, the percent reduction of these small particles, in this case with infectious virus, and they even cultured the virus again from the receiver, and they did RNA testing also, you can see that there's really a significant percent reduction on that left graph. And then if only one—
Robert Locke is on here from from Obria, Jen Welch from Habitat.
Oh, okay, good. Anyway, so anyway, just want to mention that it's just a demonstration of the use of masks, and this summarizes it, that distance matters too. But this was actually done with these two mannequins at 3 feet. Of course, we'd recommend 6 feet. But when you got both people masking, and you do come within 6 feet, you have that extra measure of protection. So just really want to emphasize masks matter. If we can get people masking, we're gonna bend this curve. And so that is the #1 recommendation that we have right now. There are also, high-risk settings, unfortunately, like restaurants and bars that, you just don't keep your mask on. And when you mix alcohol, even less so. So we have to think hard about that. But anyway, I want to stop there. And happy to answer questions if you want to have Q&A, but whatever you say, Dr. Rona.
Okay, Paige, are there any questions, or anyone online have a question they want to put in the chat?
So I have, are younger children spreaders?
Less so, but they are still. Yes, they do get asymptomatically infected, mostly asymptomatically, and they are spreaders for shorter periods of time, but they can spread. Yes, and they have spread to older people, but the younger, the less so.
Okay, and so how long does the virus stay airborne?
When it is airborne. Okay, so we actually came out with some a longer discussion of this in about 3 weeks ago. It was called How COVID-19 is Spread. And we emphasize that, there's these terms airborne. What I've shown you here is what most people would say close range. You might say airborne because those are very small particles, but we often call that droplet, but that's a semantics issue. When it's truly in the small particles, it's not very long. I mean, we don't have these instances of people going into the same airspace and getting it hours later after someone left, okay? There is one outbreak where someone went into a squash court, where you athletic activity, and they got it after the person had left. But that is the exception. We don't have it hanging around for hours. What happens is after you get very far distant and it's been out there a while, it disperses into, the volume. The particles get very, very low. So in number and density. And so you could, try, I don't even know if there's been a couple studies where they've cultured it for some period of time after. I cannot remember exactly what that is, but from a standpoint of getting the infection, it is essentially while you're both in the same airspace, the same room, okay? That's where the risk is. Someone leaves the room, there's rare instance, like I mentioned, that squash court instance, but they're anecdotes really, okay? It's while you're in the same room, while you're talking to the person, again, speaking is especially, looks like you make a lot more of these particles. And then eating, again, also is part of that, because as you're eating, you're talking. And so it's being in the same room, especially within 6 feet, but even probably outside of 6 feet, if you're in the same room, that's why it's important to mask if you can.
Okay, and then speaking of masks, there's quite a few questions about the types of masks. And so homemade masks, are they okay with being washed regularly? And the difference, gaiters, using gaiters,
Yeah.
are those as effective? So if you could speak to that.
Yeah, sure,
And,
sure.
and also somebody asked about face shields in place of masks. So
Yeah, thank you. Those are great questions. So initially, I think we saw there was a publication that suggested gaiters weren't that good, but we've gone back and done some of that work with gaiters. And if they're, the main thing is multiple plies, multiple layers, okay? Multiple layers, gaiters work just fine. And cotton masks are mostly what we're recommending. Just cotton multi-ply masks. They can be homemade. You know, they can be from Hanes, whatever, but that's most recommended. I mean, also we do recommend, if you can get them, of course, procedure masks. Those are usually multi-ply. But the difference is between those, and you saw some of that on that slide, and we'll be happy to share these slides. It's not that much when you talk about a cotton versus a procedure mask, a medical grade or even surgical mask. They're not that much different. The big thing is to have any mask on, especially the spreader. And so gaiters are fine as long as multi-ply. And cotton is just about as good as surgical masks. Was there another part to that?
the face shields versus
Oh,
masks.
face shields.
and
Yeah,
as
thank
well
you.
as the those who have the masks that have the
Vent. The
vent.
vent.
Yes.
The vent, yeah. So face shields are not as good. I mean, face shields are good for direct splatter. So if you're going to wear a face shield, wear it also with a mask. Okay. Don't use a face shield in place of a mask. Okay, that's the key there. Especially, you know, the spreader, it doesn't do much at all. But even as the protector, you're breathing in from the side. And I mean, it's true that these masks are not. Realize none of these masks that we're talking about today are fit tested. They're not like we're getting a complete seal, but even so, you're breathing mostly through the filtering material. And so you're just decreasing the number of particles you're getting. So face shields only along with a mask. And the other part, I'm sorry, you had another part.
Nope, that was it.
That was it, okay.
The vent, I think, but we covered.
Oh, the vent, yeah. The vent, generally what we're saying is don't use vented masks, but you could use them if you put some tape over that vent. All these vented masks are basically one-way vents for exhaling out. They're not designed for source control, right? We want these masks to be both source control and filtering protection. And we're not protecting other people if we're breathing out through that vent. Now, those vents don't always even open. I'll qualify that, but we would just say if you have a vented mask, put some tape over that vent to keep your air going through, your exhalations going through the filtering material.
Great, thank you. Tom, that's all
Very
the
good.
questions for now.
All right. For Dr. McDonald, we appreciate you fielding the questions. We've got some time allotted at the end for some additional Q&A because I think there's still a lot of questions popping across here, but I think
Okay.
we need to get on into some of the other topics.
Yeah,
We've got
sure.
a lot to cover this morning. So next up, we've got Dr. Arona. So Dr. Arona, if you will step in, for those of you that don't know her, I can't imagine anybody that doesn't know her at this point, but she's our leader from the health department here in Gwinnett, Rockville, Newton. So Dr. Arona.
All right, thank you. Thank you very much, Dr. McDonald. I really appreciate all that. It was very helpful. I'm just trying to figure out how to, where's the slideshow? Here it is, okay. Okay, great. So let me just start with some numbers here. As Dr. McDonald indicated, you know, our numbers in the United States and Georgia are rising. Fortunately, our rise in cases, like he said, is not as sharp as surrounding states and especially the Mountain West and Northwest. But worldwide, we're over 55 million cases, over 1.3 million deaths. United States has toppled 11 million and 248,000 deaths. In Georgia, 391,000 cases. Almost 8,500 deaths. In Gwinnett County, almost 34,000 cases with 475 deaths. So and I can share these slides with everybody later. But like I said, what's important about these numbers really is that in Gwinnett, 8% of these cases that we have here have required hospitalization. Now, back in March, that was actually 20% range. And the median age of our cases in Gwinnett County is 38. Initially, the average age was in the 50s. And so 54% of the cases have underlying medical conditions. And in March, that was in the mid 70%. So what all this means is that as time has passed this year, our cases are younger, healthier, less at risk of severe disease. And from late February, this is what our cases have looked like. Remember back in mid-April here, when we were worried about hospital surges and ventilator supplies, we even canceled outpatient surgeries at this particular time, worrying about hospital surge. And that was during this initial peak. Yet here in July, midsummer, when we experienced a large number of cases, we were not as concerned about hospital surge. We were, but we didn't see, look how dramatic of a difference that is. And we did not cancel outpatient surgeries at this point. We had resumed them and didn't. So this really speaks to what Dr. McDonald was saying about the brilliance of our medical community and the doctors and the knowledge gained really about this very different virus and how to treat it. So Gwinnett County, as I said, had lost 475 lives so far. And this slide shows that the reported deaths among our residents in our districts are here. So you can see that despite the large rise in cases over the summer, our death rate did not fluctuate to that degree, which is really awesome. And here you can see our hospitalizations mimic our reported cases with really about a 2-week lag. The percentage of cases requiring hospitalizations has lowered. You can see that percentage here versus now. Every one of our hospitals have surge capacity plans in place in case our numbers increase. Interestingly enough, the hospitals of COVID, are slightly increased, but for our county is pretty stable. And yet a lot of the hospitalizations have increased. So keep in mind that, managing chronic medical conditions is extremely important. And people have been hesitant to visit their doctors this year and may not be, tightly managed with their medical conditions. And so that's why I think we're seeing some increase in ICU beds because of other conditions outside of COVID. So why are our cases lower and not rising as fast as others? And how have we been better able to protect those at most, severe risk of severe disease and death? The only thing that we can do, by the way, this is, sorry, I meant to tell you that here the health department alone has tested over 100,000 people, which is about 1/3 of the tests performed in Gwinnett County. And overall positivity since March, we follow that. We follow the daily positivity, which ranges, pretty far. And we look at our 14-day case rates, and really our health department follows this strictly because we've really got to get an idea of the COVID transmission in our communities to really help community partners help with guide their decision making. So now let me show you the reason why I think we're doing so well. The only things that we can do at this time to stop the spread of this virus is keeping our numbers from climbing further this fall and winter. And these are the things. We've got to social distance from others. We have to wear masks, keep your hands washed, sanitize everything. Stay home if you don't feel well, even a sniffle or a headache, right? Stay away from others who are ill, and of course, get the flu vaccine so that if you get the flu and your immune system is compromised because of the flu, that if you then get COVID, you won't be at a higher risk of severe disease or death because the flu vaccine really works. So Dr. McDonald went over several things to do about this holiday season. And the only thing that I would add is, try not to have potlucks or buffets. It's better to serve the meals. And of course, outside if you can with smaller gatherings. Big thing is don't participate if you don't feel well. Okay, just don't go. And if you're traveling and want to test, get one before or after, but keep in mind that because our testing demand has increased somewhat, we have about a 3-day turnaround time right now for tests. So plan on that. Social distance, of course, and we can do things. We just need to do this safely. You know, we had a very different summer. We had a very different start to the school year. And now we have a very different holiday season, and that's okay. You know, every single COVID case is preventable. Every COVID death is preventable if we just follow the guidelines and do our part. And lastly, the health department is now actively preparing for mass vaccination of this COVID vaccine. So we'll definitely have more to share at our next summit conference in January. After this meeting, you'll see an email with a survey link. It's confidential and anonymous. We really want to understand how our community feels about the community or about the COVID vaccine. If you want the vaccine, what are your thoughts? If you're hesitant, why? So please respond to this with your honest thoughts and opinions. And thank you so much for doing that. So, Paige, that's all I have.
Great. Could I ask a few questions that are relevant to your section here? Air purifiers, yes or no?
Air purifiers are definitely recommended. There's a CDC link that I can send out to everybody about what kind of filters to use, depending on your business. HEPA filters are great. So anything that we can do to minimize the transmission is a great idea. We do encourage businesses to do that. We're working with the court systems right now to go, to resume jury trials. And so we're actively pushing those purifiers where we can.
Can you talk a little bit about contact tracing? Are you seeing any patterns in any specific areas like grocery stores, office buildings, those types of things that are kind of those super spreader areas, or what are you finding in your contact tracing?
Right. Well, and that's a great question, Paige. Literally, we have community-wide transmission, so it's everywhere. The smaller, what drives people indoors and what drives people together is really what we're seeing. We do think the smaller groups are better, but when people move indoors, we think that may be one reason why the Mountain West and Northwest is so inhabited with cases right now, is because the cold weather drives people in, much like in the summertime, the heat drew people in, to the southern states. And so we're not really seeing our outbreaks are about the same. In the state, we see about 100 outbreaks every week. And that has been the same since July till now. So I don't think it's any particular place, as it is just the independent nature of what people do. And as we get tired of COVID, what happens are people just let down their guard on these measures. And that's the message here, is just don't let down your guard, especially this holiday season. We can do things and engage in things, but we just have to do it safely.
Great. And there has been a question about the number of people in a gathering, particularly related to church. I think a lot of people are really eager to get back to their faith communities. And so what are the recommendations still now?
Well, I would point you to the governor's executive order, which was extended until the end of November now. And the gathering size is still 50. I think that, the important thing is the social distancing. If you're in a space and you cannot keep people at least 6 feet away, if they're singing or exercising or in a choir or yelling, screaming, that 6 foot difference needs to be bigger. Okay. And so depending on the activity that's going on within that, especially a church with singing and that type of thing, masks are really important, and also the ability to properly social distance people. I would put 10 to 12 feet apart in a church if people are singing and that type of thing. So I think, but as far as the gathering size goes, everyone should adhere to the governor's executive order.
Very good. Thank you.
Okay.
Okay.
Very good. And realize we got a little bit of time at the end for other questions and answers too. So just keep that in mind. We'll try to get to everything. And I think, Paige, we're also sending out some documents at the end, so they'll have this information that's been presented as well. Is that correct?
That is correct.
All right. So next up, we've got with us today Sherwin Levinson, who is the director of the Medical Reserve Corps. And given all the personnel that's needed for some of this stuff, we've asked Sherwin to give us a little bit of an idea of what the Medical Reserve Corps is and how they go about this stuff. So Sherwin, if you'll wade in.
Good morning, everybody. Wave your hands if you can't hear me. I appreciate you joining us this morning. And with a little luck, you're seeing my slides. So MRC GEM is the Medical Reserve Corps serving Georgia's Atlanta East Metro area. We are all volunteers. We're a nonprofit. And our mission in a nutshell is to help out whenever the health department or emergency management needs help and asks for it. Anybody can volunteer because we need all kinds of backgrounds when there's an emergency. We don't know what kind of emergency might happen. So we have about a third of our members are licensed, active healthcare professionals or public health. 2/3 are not. And anybody can join and make a difference. And mrcgem.com/join. You'll see that a few times. Some idea of what we have done in the past. So far, we've provided over 2,200 hours of support in the COVID response. 3 years ago, when Hurricane Irma caused almost 7 million people to be evacuated, we were housing nearly 9,000 in shelters in Georgia, and our members helped out with the shelters. Back in 2009, 2010, when we had the flu pandemic that wasn't as serious as it might have been, Gwinnett, Newton, Rockdale health departments administered over 40,000 vaccinations. And this is the line to get into one of the mass vaccination clinics that were held. Our members helped with that. We also exercise, practice, train to deal with things that might happen. If we didn't know what to do, we wouldn't be ready to respond. So here's an example of where we worked with public health, emergency management, and fire services to practice response to radiation incidents. In fact, our particular MRC unit is probably the most active in the country regarding preparation for dealing with radiation emergencies, partly because we have the CDC here to help with our guidance, and partly because we're a transportation hub. Other things we might get into. Here are shots from helping with mass vaccination and medication dispensing exercises. So what do our volunteers get? Free education opportunities. Under normal circumstances, we have an event at least once a month. Once a year, we have a weekend training event where our members get the chance to get some in-depth training. This is an overnight event that with all expenses covered, thanks to the community's generous donations and grants. And we've had in-depth training in radiation response and dealing with emergencies where we need to do mass dispensing, in dealing with mass casualties, pretty much anything that our partners, the health department and emergency management, think that we need to be prepared for. You get to serve your community and its citizens during times of need. If you are part of the response, you would be one of the first responders to receive medications or other treatment. And you get to network with some of the finest people you'll ever meet. I have been so impressed with the folks that I've met because of MRC. And what we expect is that you'll try your best to come if we call you. Especially during COVID, it's been really tough for people to come out and help, because on top of some of our people, like retired folks who are most able to help, being classified as also most vulnerable, lots of people who would otherwise be able to take time off from their jobs to help out now have to take care of their children who aren't in school or weren't in school. So that's why it's important for us to have as many volunteers as possible, So if their help is needed, enough will be able to come and join us. So this is my contact information. mrcgem.com is where you can get more information. Add a /join to the end of that if I've convinced you and you'd like to join us. Please pass the word because unfortunately we're kind of a well-kept secret. So please ask if you have any questions in the chat box, and I'm available anytime by email or online or phone to answer any questions you might have. Thank you.
Thanks, Sherwin. We appreciate that. So if you know somebody or yourself that's interested in doing that, please contact him. And there's always a need out there. So next up, we're going to have Jennifer Hibbard with Viewpoint, this is the mental health for the Gwinnett, Rockdale, Newton. And Jennifer, if I may ask, once you go through your presentation, if you will introduce the folks from Navigate Recovery and talk a little bit about, so we can just go from one end to the other presentation.
Absolutely, I'll be happy to do that. Thank you so much. I don't have any slides to share. I just have some information to pass along. I wanted to just highlight some of the concerns that we've already started to kind of hear from our previous presenters, but caution fatigue is a real thing. Many of us are feeling this right now. Caution fatigue occurs when people start to slow or low their motivation or energy to comply with safety guidelines. And as you heard from Dr. Arona and Dr. Dr. McDonald, the nation has started to slow their caution, and we're all getting tired of COVID, but this is not the time to be doing that. It's still so important to practice your social distancing and practice the new behaviors that we've learned that will really help us coexist with COVID. And so from that perspective, making all of those changes to our behaviors and to our lives and being more isolated really does have an impact on our mental health. So I wanted to share a little bit of information nationally as far as some of the research that's been done regarding the impact of COVID and the pandemic on our mental health. So there's been a study from the CDC that they have noticed a marked increase in mental health symptoms. In fact, in the study, they compared the second quarter of 2019 to after the pandemic started, and there was almost a 3 times more prevalence in anxiety disorders. So anxiety disorders increased from 8.1% to 25.5%. For depressive disorders, there was a 4 times increase from 6.5% to 24.3%. Additionally, approximately 1 in 10 individuals reported that they started or increased substance use because of COVID. And because of the increase in substance use, anxiety, and depression, we've also seen an increase in suicidal ideation. So approximately twice as many respondents reported serious consideration of suicide, up from 4.3% to 10.7% in this study that was conducted by the CDC. So I wanted to then kind of dive in a little bit more to our local level at Gwinnett and share that Viewpoint Health, we are the community-based behavioral health provider. So we provide mental health and substance abuse treatment. And we primarily serve people who are low income and uninsured, but we also take Medicaid and Medicare and some private insurance. And all of our services are available via telehealth right now. And all of our clinics are still open. So if somebody prefers to walk in or if they need to come in for an in-person visit, we still can accommodate that. It's just at a much different level. We've had to change to be able to coexist as well and still make sure people are served. So it's really easier now to access services than ever. So I reached out to Dr. Terry over at our Gwinnett Medical Examiner's office just to see if they're starting to see the impact of increase in deaths due to overdoses and suicides. And so Dr. Terry did share with me that they have seen a spike in overdose deaths since the pandemic. In fact, in March, there were 3 overdose deaths. And then April through July, during those months, we averaged 11 per month, with the highest being 14 overdose deaths in June alone. Then right now, this is real new data, so it's not really mature yet. There seems to be a slowdown August through October, but there's still 30 overdose deaths cases that are not yet certified. So I don't think that that dip is really accurate yet. I think looking at those April through July numbers are probably more realistic. And I know that you'll hear from Navigate Recovery after, and they can probably talk to you a little bit more about what they're seeing in the emergency departments. So of the 72 overdose deaths that have occurred so far in 2020, only 3 of those were determined to be suicide. The rest were determined to be accidental. So when we dug into the suicide rate a little bit more, surprisingly, suicides are actually down from the previous year. So we've still got 6 weeks left in this year. We don't have all of, this year hasn't been completed, but as of right now, we've had 69 deaths by suicide compared to 109 in 2019. So our rate is lower than it was last year. But alarmingly, the homicides are up. This was something that I just learned after reaching out to Dr. Arona, so I don't really have any causality behind this. I mean, sorry, Dr. Terry, but last year, or sorry, still just within this year, we've still got 6 weeks left. We've already had 49 homicides. In all of last year, we only had 37. So in fact, that 49 is the highest number of homicides that our medical examiner's office has worked since the last 6 years of data that I was looking at. So some alarming information coming from the medical examiners, and also just know that this is not every death that happens in Gwinnett. This is just the ones that the medical examiner's office is assessing. So now that we know that we need to be concerned about mental health issues and the impact that, that it has on us, I wanted to share some coping skills. So there's the standard coping skills that I know you all know. We need to eat healthy, we need to get enough sleep, we need to exercise, we need to limit alcohol, limit caffeine. But sometimes it's hard to do that, especially in the time of stress and anxiety. But I wanted to also provide, those are very important, and those are kind of your core coping skills. But I wanted to also provide some additional tips. It's important to pay attention to what triggers you. We're all triggered differently. So notice whenever you start feeling anxiety and depression, and think about what it was that triggered you. You can write it down just to kind of start watching your own patterns. But I also want you to recognize that a lot of us are grieving. We're grieving all sorts of losses right now. And so allowing yourself to recognize that you're grieving that loss, you're grieving the time that you get to spend with your friends, your family, thinking about the holidays, that they're going to be a lot different this year. So allow yourself to acknowledge that loss, but then replace that or fill that then also with gratitude, because there's still a lot to be grateful for. And so if you kind of calm your brain by recognizing the grief and then allowing to reinforce it with joy and finding something that can bring you joy. Remember to allow yourself to laugh. Even though these are really challenging times, there's still plenty of opportunity to laugh. You can laugh over Zoom with your friends, even if you can't be in the same room together. One thing that I've really had to do is turn off the news. I know we've got to stay abreast, but you don't need to have it 24/7. Turn off the news, take a break from that. Choose to get your news at regular intervals just so that you can stay updated, but it doesn't have to stream all day long. Turn the pop-up off of your phone so that you don't get interrupted and pinged with new updates. Some additional tips: recognize that you're not alone. We are. I heard something the other day. We are all in the same storm. We might be in different boats, but we're in the same storm. So that really helps to recognize that we're not you're not alone in this, and we just don't have control over this right now, and that can be difficult for us to manage. But remember the self-care activities that you do that do help, and then maybe even have some way, some mechanism to share that with your friends and your loved ones, to even if you just scheduled a call to say what's working for you right now. Is it sharing recipes? Is it baking pies? Is it, doing something good for somebody else? That really helps. If you can make banana bread and drop it off at a ER for the frontline workers, I mean, that really helps give yourself that sense of purpose and value and meaning, and it's so helpful to our mental health. So if you're doing all of this and you're still struggling, get help. If you've tried to pull yourself up and it's not working, or somebody that you know is trying and it's not working, please seek help. Seek help early. Don't wait until it's a crisis. This is not something that you want to put off. It's so important to take care of your mental health and your mental wellness. So I'm going to put something in the chat as a resource. Mental health, I think it's Mental Health America or Mental Health of Georgia has, it's Mental Health America has a screening tool for anxiety and depression and many other mental health issues. So I'll put that in the chat, and just feel free to use it, send it to your friends, check it out. And then there's also links to access resources. I'll also include, there is a 1-800 crisis line for Georgia. It's called the Georgia Crisis and Access Line. I'll share that in the chat also. That's statewide, and you'll talk to a therapist and they will connect you, kind of a warm handoff to the appropriate care. And feel free to share that as well. I also wanted to just mention that there's been some more research about how mental health conditions are disproportionately affecting certain populations. So just be aware of that within yourself, your family, and your circle of friends. But mental health conditions are disproportionately affecting young adults, Hispanic persons, Black persons, essential workers, and unpaid caregivers. That is something that really stuck out to me. Unpaid caregivers who might be currently providing critical care to an aging person or somebody who might be at high risk for COVID. They're really struggling right now. And so Paige actually has another resource that we want to share, that's Caregivers Resource Center in Snellville. There is a resource out there for our caregivers. So be mindful of this. Telehealth, again, is widely available. You can seek private, confidential, low cost, even free treatment right now from the comfort of your bedroom or your living room or wherever you want to go. So please don't hesitate to seek help. It's not a sign of weakness. It's the right thing to do. And I'll pause there for any questions. Oh, no, I'm going to not take questions. I'll take questions at the end. And I'm going to introduce Susan and Farley Barge, great partners and friends in the community that are the co-founders of Navigate Recovery.
Thank you, Jennifer. Can everyone hear us? We had a little technical difficulty here and lost the internet in Hall County. So can you hear us okay? We're on the phone now. Good, guys. See Jennifer shaking her head. So thank you, Jennifer. And just to really follow up on a lot of that, Jennifer, thank you for those guidelines and tips, because we're really seeing a lot of that too. A great number of the people that we serve are fatigued. They don't always have the best coping skills to start with, and so they're struggling in this time of COVID. It's just layered. I like to say that if most of us, on a dial of 1 to 10, if most of us live our lives at 10 or 9 or 8, with very little margin, that we're actually all living at 11 now with COVID, because it just adds that additional stress into our lives. And it hasn't gone away like we thought it would. It's persisted and lingered. So those are great tips, and we appreciate that. What we're really seeing in terms of Navigate Recovery is that a lot of people are not accessing the resources that are available, whether it's fear of COVID, and that's both in the hospitals as well as in the meeting rooms. There's that, I think there is that COVID fatigue that Audrey talked about earlier, and that we're just seeing a lot of that in the community. And there's the potential, or at least the idea that people kind of give up on their addiction recovery when they feel like they don't have access to services, when they feel like they can't meet with someone in person, when they feel like they are always restricted to a Zoom call. I think the technology is great. I love technology, but it doesn't replace that personal interaction. And I think that's an element that's really important to people in addiction recovery, and their mental health is being affected. I would like to say that that there's, through the partnerships that we have, both with the Gwinnett Health Department, with Viewpoint, the hospitals, the Department of Behavioral Health, and thanks to the Lawrenceville Rotary Club, which helped us get this started several months ago. Our Narcan training has been a huge success. And so we have been able, for those of you that don't know, Narcan is an antidote to opioid withdrawals and overdose that will revive that person. And in many cases, it's life-saving. In fact, we just had a great story that happened just a couple of days ago with a local residential recovery program that were able to use Narcan successfully to revive a resident who had overdosed, and that was made available to them through the training that we provide.
I think we've lost him.
Looks like their technical difficulty has returned.
Okay, well, let's give them a chance to dial back on.
Yeah.
Jennifer, could I ask you a quick question while we may have a pause here? There was a question in the chat about mental health issues to watch for with kids. Do you specifically have advice or things to watch for with children?
Absolutely. Kids will present a little differently, and sometimes it'll come across more as unruly behavior, acting out in a way that is just uncharacteristic for them. So it might not really look like depression or anxiety. It might look more like irritability, aggressive, talking back. So just as opposed to coming down as a parent and being punitive, you might want to take a step back and say, is there something going on? Is there something that's bothering you? Are you worried about something? Go ahead and give them some of those words that they might, especially younger kids, that they might not know, to say, yeah, I feel nervous, or I feel butterflies in my tummy, or I don't want to leave the house, or, just some of those, just kind of create that space and open up more to have that conversation.
Great.
All right.
Well,
Farley, do we have you?
Farley's
we do
back.
have you back. Very
Great.
good. Very good. You got to unmute though.
Y'all are unmute. Y'all need to unmute.
Farley, y'all need, there you go.
There we go. Can you hear us now?
Yes.
We have COVID anxiety, we have Zoom anxiety, we have Wi-Fi anxiety over here. Very little margin. Farley asked me to just talk a little bit while he regroups about what we're seeing at Lightway Recovery. That's our newest venture into residential programming. We have a residential program that's a year-long, 6 months of intensive care, 6 months of transitional care for women. And we approach recovery here as peer support, people in recovery, helping people who want recovery. And we also approach it holistically. So we approach it on the mental, spiritual, and physical level. And we look at long-term wellness for people. So we launched in August, took our first person at the end of August, and it's been interesting. I do agree with what Farley was saying earlier. Hopefully you heard that people are hesitant to access care, especially in a residential setting. We've implemented some great COVID protections, and we've had no issues whatsoever. But people are hesitant, and there are also additional issues in going into long-term recovery, especially for moms who may need help. And that is a focus of ours, is pregnant women and moms. Now, a lot of the moms became teachers in the spring, maybe are hesitant to put their children back. And, you know, they're isolated with their children at times, and dealing with all that additional anxiety and stress that Jennifer talked about. So it's been a slower takeoff than we expected, honestly. But we also see in the house, although we live somewhat in a bubble here at Lightway, even the watching the women interact with Zoom meetings as opposed to our plans were to go to in-person meetings is really interesting. There's not the same ability to connect over a Zoom meeting in a support group type setting as there is. There's some great ones happening, and we certainly are doing a blended meeting or two at Navigate Recovery, but it's just not the same for the women. So, you know, my concern is the time that they're here is ticking away, and they haven't really been able to connect with people out in the community, which is such an important part of recovery for the long haul. So we're grateful that we're helping the women that we can, and we invite you, if you have any questions about whether this might be suited for someone you're serving, to please get in touch with me at lightwayrecovery.org, and I'll turn it back over to Farley.
And I'll finish up quickly, and I apologize for the technical difficulties again, but just to emphasize the Narcan training that we now provide every other week, and that's provided on Saturdays. We can do more. So if you want to have a special group or someone come in, we'll be happy to provide that. And finally, I will gonna say that one of the challenges that we have in our area and in our state really is that overdose numbers are only reported by hospital emergency departments currently. That's only a small number of the people that actually experience overdoses from opioids. And because we know that first responders are also responding. And I really wanted to applaud Audrey Arona and the Viewpoint Health Group and others and partners in our community that are pioneering something that's been around nationally for a while, but we're just implementing it here, which is called OD Map, which is simply an app that first responders can enter overdose data into so that we can track this nationally. Nationally, we know the numbers have increased during COVID about 17%. Georgia was tracking along with those numbers in the last release of data. That's about 2 months old now. So what Jennifer and I have talked about, and others, is that there's a wave of mental health and addiction coming our way as a result of COVID, and many of the orders that we've all had to adhere to, such as shelter in place and just lack of access to services. And so we're just trying to get prepared for that now and working on our action plans. And but I feel like we've taken too long, so I'm going to stop now.
I guess I got to unmute first. All right, we appreciate all this information. I think this is great. Randy?
Hello?
Well, we appreciate all the information that you guys have given us this morning on the mental health side of this. We're going to swap the agenda around just a little bit and bring Scott Maudsley on to talk a little bit about the Gwinnett Cares and the resources that are out there currently. So Scott, if you want to move on.
All right, great. Well, I won't take long, so I think we're going to get a testimony today before Q&A. But we launched, as you heard, Gwinnett Cares 9 months ago now for two reasons. One is to help those who need help to get help, and two, to help those who want to help connect to places that they can help. So it's important that you know that we are connected to hundreds of organizations across the community to help meet great needs around issues like food and supply needs, housing, healthcare, et cetera, et cetera. So if you're on here and you're in a place where you need help or want to help, to get more information, we want to encourage you to stay connected to our website at gwinnettcares.org, connected to the Gwinnett Coalition and all the great work happening there. If you need help, there are plenty of partners that you can find there. Or if you want to help, there are places you can volunteer or donate. So make sure you go there. It's your kind of one-stop shop to be able to get the information you need. Also want to encourage you to follow us on Facebook so you can stay connected in real time to events like this one, as well as ongoing resources available to you. And so we're just honored to be a part of things like this that are helping people get help and helping people help others. So Tom, back to you.
All right, very good. Now bounce back to Paige. Paige, did we end up with a testimony? I thought we were going to go
We do
through
have a
this.
testimony. I'd love to introduce Randy Redner with the Community Foundation for Northeast Georgia. Randy has, his family has been significantly impacted as he has been one of the key leaders in this community leading the charge. And we'd love for Randy to just take a moment and remind us all that COVID is not just this thing out there. It is really something that impacts people's lives and why our focus on healthcare is so important. So Randy, turn it over to you.
Paige, thank you. And I thank everybody on this call. I see a lot of friends and who have helped me and my family, in our journey. And Jennifer, I really appreciated, your comments and your thoughts about, I could checklist some of those things, but you gave me some new things, as always, young lady, to think about and share with my family, because it certainly has been a journey for all of us, right? That when we started the year, we had no idea. And there's a couple of sides of that, right? There's the personal journey and there's the professional journey. And for me, the professional journey started on Friday, March the 13th, when we were all meeting, Scott Mosley and I and another team meeting at 12 Stone Church to help create Gwinnett Cares. And, thought in the beginning, we thought, okay, 45 days and we'll be through that. We missed it by about 7 months. Or maybe, 18 or 24, whenever we all get through it. So there's been this professional journey, in the center of the storm in my work here at the Community Foundation. But on March 12th, it became a personal journey when my father-in-law was put in Emory Johns Creek Hospital. And we lost him to COVID 15 days later on March 27th. He was one of the first 10 or so Georgians we lost. He was one of the first 1,000 Americans that we lost. And our family off on a journey there. My mother-in-law moved in with us, has lived with us for the last 7 months, and we're just been able to move her to her own apartment again. My mother-in-law diagnosed positive with COVID, my wife positive with COVID, my daughter positive with COVID, my son-in-law positive with COVID. We've been quarantined 3 times, and Dr. Arona has been with us. So Audrey, thank you to you and your team, because you guys have been every turn, have been with us, including last week when my wife and I got tested yet again, my 7th time to get tested. And we came back, fortunately negative. And it was a text message and a call back from Audrey to let us know the good news from there. So it's been a journey. This past Sunday, we did a family service for my father-in-law. And when I say a family service, it was 7 of us in the cemetery, socially distanced around his grave, just 7 family members for the first time, to share with each other, to cry with each other, and figure out, how do you take that next step in the journey from there. And it continues, certainly for all of us. And right now, as all these healthcare experts have said, the only thing we have to battle this thing at the moment is human behavior. we really do control our own destiny. I believe that. My family believes that. We can decide to mask or unmask. We can decide whether to social distance or not. We can control this until that vaccine comes along. But that's a ways away. People often ask me, what have you seen, Randy, from your seat at the Community Foundation? And, my line for that has always been, it is often in the worst of times that we see the best in people. And we have seen the best in our community over the last 9 months, but we're going to have to see the best for a while longer. And we can do that. So my message is to you, stay happy, stay healthy. We have Thanksgiving next week, and we have a tremendous amount of things to be, thankful for. So I appreciate this time this morning just to share our journey. I know each of you have been on a journey yourselves, and we will get through this, and we'll get through it together. Thank you, Paige. Thank you, Thomas.
Thank you, Randy. As you heard them talking a few minutes ago about the fatigue in all of this, but that's just from people that have not had to experience this and not have had, because it seems the things we hear about it. I mean, this has been an unreal journey compared to what we've had in the past. So, Randy, we appreciate so much you sharing that and bringing it home to us, because unless it impacts you directly, sometimes it takes you a little while. So we appreciate that. Audrey, we're going to bounce back a little bit. I think Paige had a number of questions that we were wanting to come back to and have you and Dr. McDonald to field, if you don't mind. So, Paige, you want to pull those out, or I think you were going to talk about the vaccine first, though, Dr. Arona.
Sure. Let me, I know I was going to share that last thing, but the vaccine, let me just tell you briefly what we know about it. There are several that have finished their phase 3 enrollees. And again, Dr. McDonald can add into this and correct me if any of my information is wrong, of course, but Pfizer has enrolled 40,000, Moderna enrolled 30,000. Pfizer enrolled some children, 16 years old, that type of thing, but we don't expect the EUA, which is Emergency Use Authorization application to the FDA, to include children at this point when it's rolled out. But both of them have completed phases. In terms of case analysis so far, Pfizer reports a 90% effectiveness of their vaccine with the small amount of cases they've looked at already. Moderna did the same and found a greater than 90% effective rate. The thing that Moderna saw was 11 severe cases. None of those were in the vaccine recipient group. So this may be effective and good at preventing severe disease. So again, we're looking closely and following that data. Both of them will be applying rapidly for the emergency use authorization through the FDA. This is not full approval. It's just under emergency use. The FDA has promised a 2-week turnaround to assess and make recommendations. And then the ACIP group, which is the Advisory Committee of Immunization Practices, which sits at the CDC level, has promised a 48-hour turnaround to make their recommendations and guidelines. We have been told that the approximate number that Georgia can expect, Pfizer has said that they should have 40,000 at least doses available by the end of the year, and Moderna has said about 30 million doses. Did I say 40 million or 40,000? But anyway, 40 million and 30 million doses available by the end of the year. And we've been told that for every 10 million doses that are made, Georgia should receive about 300,000 doses of that, just to give us an idea of how we can do this. So that means, if Pfizer gets that, then we should get 1.2 million doses to our state from Pfizer and about 900,000 from Moderna if those things turn out. So again, based on the immunity response data, the Operation Warp Speed General that was visiting our state recently told us that, they think that the first 2 doses, both of these vaccines will be 2 doses, and that they don't expect it to have to be an annual vaccine at this point, although that's still preliminary. They are looking at a possible booster in 2 to 4 years. That's the information that was told to me. So in terms of the distribution of it, the CDC contracted with with McKesson, who also distributed the H1N1 vaccine. There are priority populations already kind of drafted from Georgia for vaccine allocation, and they're split up in 4 different phases. Of course, phase 1 is split between phase 1A and phase 1B. Basically, healthcare workers, those directly exposed to patients or infectious material would be first. Elderly adults with at least 2 comorbidities or medical conditions. Phase 1B would be people who play a key role in essential functions and non-medical, fire department, law enforcement, non-clinical healthcare staff, and staff and older people who live in long-term care congregate settings. Phase 2 would be school faculty and staff. And again, I emphasize, remember that there will be some teachers that fall in the phase 1 group because of their medical conditions. So don't assume that faculty staff means that teachers have to wait till phase 2. So again, it'll all be prioritized. Phase 2 also includes essential workers in high-risk settings like truck drivers, grocery workers, food processing, individuals in homeless shelters, congregate settings like correctional facilities. Phase 3 would be workers in industries important to functioning society at risk of exposure, like, hairstylists, that type of thing, and children and young adults. And then phase 4 is everyone else that doesn't fit in prior. So that's kind of the current draft situation. I'm sure there'll be some tweaking going on there, but I wanted everybody to know those phases. Dr. McDonald, do you have anything to add about the vaccine?
No, I'm glad you were on because I didn't have that ready at hand. Yeah, we're excited, of course, by these vaccines. They are, early in these phase 3 studies, in terms of duration. I think right at this point, they're like 2 months into their phase 3 studies. So the protection so far, in fact, the early results are probably very, very early. So we're definitely seeing a signal of effectiveness. How long it will last is still the question that will be still sorting out. So we definitely see effectiveness. We do know that there's side effects. They're mostly aches and pains and maybe low-grade fever, which could be on the higher side of vaccines. I personally just had the Shingrix vaccine. I don't know if any of you have had that. That's a hardy vaccine to take, and I have to get the second dose of it. This will probably be one also that you'll get some local side effects and aches and pains, but that's better than the infection, obviously. So.
Well,
another point I want to make is that it'll be key that these 2 vaccines, if they come out at the same time, that you get the same one for the second dose, right? They're not interchangeable.
Great, thank you.
so I guess we have time for a few questions. There was some questions that we did not answer. Dr. McDonald, thank you so much. You've been so great to follow the chat and answer a lot of the questions that have been presented. But there was a question about recurring cases and someone who has had it and being reinfected. Are we seeing a lot of that? Is that possible? And do we need to be mindful about that?
Not seeing a lot of it so far. It's definitely some case reports in the literature. We're probably beyond sort of tracking those to seeing people try to assemble more series of cases, but it's not, with the millions and millions of primary cases, we're not seeing hospitalizations or deaths in a reinfection type situation. That would be probably declaring itself by now if that was common. With that said, we know these coronaviruses, there's 4 endemic or usual human coronaviruses that cause mostly cold type symptoms, and they do cause recurrent infections in people. Right now, the CDC guidance says that if you've had the infection and recovered, for 90 days thereafter, you would not have to be re-quarantined. After that, you potentially would. And why? Is because we just don't know how long you will be protected. But we do, see protection, and it makes sense there would be protection from everything we know. And now the vaccine studies are supporting that too. Over.
Great. Thank you. We also had a question about Christmas caroling going into the holidays. Is there a safe way to do that?
Outside, obviously. And I put probably a little more than 6 feet between you. I'd probably put more, like, since you're singing, maybe 8 feet or so, or 10 feet. Make it a stereotype outside event.
And I would add masks. Make sure they wear masks.
Yeah, I'm not sure if you can sing with the masks on, but when you're walking from place to place and gathering together.
I think we are all learning to interpret the teacher on Charlie Brown more and more as we wear our masks. So I think it could be kind of fun. Okay. Those were the two questions that I had. There was some question about cases in the schools and just the safety of schools. And I know I personally heard a report earlier in the week that talked about actually schools are proving to be some of the safer environments out there right now because of the diligence. But can you speak to that, Dr. Arona?
Sure. We are seeing outbreaks in schools, of course, and most of the cases that are in the schools are not transmitted within the schools, we believe, but brought, the cases are from outside exposure. We do see in our outbreaks, like I said, our outbreaks are pretty much the same. The first place of outbreaks really kind of flip-flops week to week between long-term care facilities, workplace facilities, and schools. So some weeks the schools topple and some weeks the long-term care facilities. But remember, on average, our outbreaks are really about 100, and it's been that way since then. So the good news is that schools opening and the fear that was all there, I think, hasn't manifested itself, which is good. I mean, obviously, every case counts, every death matters. So I think we're doing, I think at least in our district, we're doing really well in terms of trying to protect the most vulnerable. But again, all those measures really need to be adhered to, and we can't let our guard down.
Okay. We hear a lot about asymptomatic transmission, and that just is a little troubling. Can you talk a little bit about that? And I mean, how do we know?
Well, and Dr. McDonald, you can clarify this, but what we've been told is 20 to 40% of cases are asymptomatic. So what's important is, like we've been saying since early March, assume every single person next to you is positive and assume yourself is positive. The thing that I noticed this week, and I don't know if you want to speak to this either, Dr. McDonald, but asymptomatic carriers of COVID have weakened immune systems just like the sick people do. So the flu shot is so important because even if you're an asymptomatic carrier, that COVID weakens your immune system. And if you get the flu on top of that and hadn't got the flu vaccine, you're going to be in trouble with the flu. So again, it's kind of, one benefits the other. So again, I'm pushing that flu vaccine message. Dr. McDonald, did you want to add anything to that asymptomatic issue?
No, just that, yes, there's definitely transmission from asymptomatics and pre-symptomatics. On the whole, it looks like they have a similar amount of virus at their peak to symptomatics, but they might shed a little less time after the peak. So overall, the period of shedding might be shorter with asymptomatics than those who develop symptoms, but that the peak viral shedding looks very similar. Over.
And then I want to, one final question. It says, how effective are the COVID tests proving to be? And is there a lag between COVID infection and when it would likely show up as a positive? So, you know, when is the best time to get tested to have the most accurate result?
Well, I can tell you the rapid testing that's out there, we really don't recommend that test unless you're symptomatic, because they have a very high false positive, or not false positive, false negative results. So again, we try to use the rapids just for people who are very close to symptoms or within 7 days of symptoms. The PCR test is the gold standard. And, you know, we think that's very, you know, effective at picking up. Are there false positives and negatives? I'm sure there are. The most important time to get a test is not right away when you've been exposed. I noticed in the chat there was a question about, if I get exposed at 9 a.m. this morning, will the test show that I've been exposed at 3 p.m.? And remember that the incubation period of this virus is 2 to 14 days. That means it's going to take a minute once you're exposed for that virus to replicate enough inside your body to either produce symptoms or to present a positive test. So we don't want people running right out to get a test. Number one, it's probably going to be negative, but secondly, it gives people false reassurance, and then they go out in the community and kind of forget about their exposure when actually they're in danger 5 days later. And like Dr. McDonald said, you know, that seemed to be 4 to 6, you know, day window is when most people developing symptoms from that. And again, so what we recommend is that if you're in quarantine, adhere to those guidelines, because then if you become positive, you're not going to have any contacts, right? That's how we stop the spread of this virus, right? But if you're in quarantine, look for symptoms. And even if you get a little sniffle, whatever, get a test. That's the time to get a test to make sure. But if that test is negative, you still have 14 days of quarantine. And to make sure you're not an asymptomatic carrier, get tested on day 10. That's the best time to get a test to make sure you're not an asymptomatic carrier. Dr. McDonald, did you have anything else to add?
No, I mentioned that in a chat with Nathan, I think asked that. Wouldn't expect it the same day to go positive. First would probably be 48 hours, but as you said, it's not to, there's only a few times when you want to sort of test someone who's a contact like that early, and it's usually if they've gone on and exposed other people, right? Because then you want to sort of break a chain of transmission. But otherwise, if you were going to get one test during the incubation period, it'd be more like 6 or 7 days into the incubation period. You're going to get one test to try to detect any asymptomatic infection during that time. Otherwise, you wait for symptoms and test right after symptoms to diagnose a case, because these are the times that you're most likely to get the positive test. Over.
All right. Well, very good. Well, we've reached the end of our allotted time this morning. I appreciate all the speakers. It's great information. I appreciate the attention and the questions from everyone that's come in here. And remember, you'll get some information from a page later for all the presenters' documents that you saw this morning. Plus, if you've got questions following this, we need to get you those answers. So send them to Paige, to me. You can get our email addresses, send them to Dr. Arona, and we'll get you the information that you need to do things either in your business, personal, however you need to do it. We're here to try to provide that resource. But appreciate your time, appreciate your attention. And with that, we will be adjourned. Thanks again.
Thank you.
Thank you, everyone.